Hi, everybody. Thank you for joining us. And Dr. Astor Vass, founder of Dental Student Society. And we have a wonderful speaker today, Dr. Carmen, from NOAA Prosthodontic Program. And we're excited to learn a lot from her and her journey.
Thank you so much. Everybody, welcome here. If you are here, it's because you are looking to get a license here in US. And I feel you because I was in the other side just a few months ago. So I understand how is the journey. At the beginning, the journey, I was thinking it was like really straightforward, that it will be easy to do, just getting the pass in the board, just getting the right TOEFL score. That's it, apply. But you can go to the next slide. It wasn't like that. It was a little bit more complicated, and it's a lot of ups and downs in the journey. But if you really want, that dream is gonna come true. So right now, I'm living the dream. And I feel really passionate to be here. But one of the pictures that you see there, the left one is in the clinic, and the right one was my first day of dental school. But before talking about what I am right now, I'm gonna tell you a little bit about myself. So I graduated in 2017 in Venezuela, where I was born and raised. I graduated from Universidad Santa Maria. In that moment, I did 1 year, well, 3 months in the middle of the jungle doing my internship there, and it was really fun to do. And it's so different, the dentistry that we used to do there than the dentistry that we do here in US. And then in 2020, I started my program in a prosthodontic program in Universidad Central de Venezuela. And at the same time, I was working in my private office. I was doing most of the pediatric dentistry in that moment. I was doing research too with the International Association of Dental Research at that moment, and working in a no-profit foundation or a no-profit organization in that moment. But in 2023, I decided to move here to US. I didn't finish my residency program in prosthodontic in Venezuela because a lot of problems. I came from a beautiful country, but with a lot of problems. So I decided, as many as you, to move to US to pursue a dream. So in 2023, I arrived to US on January. I was living in Texas, and I started working as a dental assistant. I was working in a prosthodontics specialized dental private office. And at the same moment, I was working as a dental assistant, working as a babysitting, and I was studying for the board, assisting to meetings, and studying for TOEFL, doing everything at the same time. In 2023, I went to Tufts University, and I went to Boston University, and I also went to Nova University to meet everybody there, because I want to make, in that moment, I want to make the right choice of the university that I want to go and apply. So in 2024, I start my program in Nova University, and that's what I want to talk right now about prosthodontic in Nova. But before I start that, I want to tell you, and I'm going to be really honest with you, that one of the fact, when I start doing all the research about the program, I told myself I will never apply to Nova because it's too expensive. That was my first thought. And right now, as a shark, as a Nova residency program right now, I'm going to tell you a little bit about the program and why you should join us in the future or consider to do a prosthodontic residency program. So I started my program in this July 1st in 2024. I moved from Texas to Fort Lauderdale, Florida, that right now I'm living here. It was a process where the application process is through a DEA pass. I don't know if most of you know, we have a DEA copy and a DEA pass. So Nova participate in the match program. So you have to submit all your papers, and then you're gonna have an interview if you get called for the interview. It's gonna be a whole day of interview, and the program director do it that way because PROS is a really competitive program, and you're gonna be in a lot of pressure. So the day start with a little meeting, then you're gonna have interview with faculties, 3 different mini interviews that is gonna be 15 minutes each. After that, you're gonna have discussion of the treatment plan presentation, and then you have the lunch, and after that, you're gonna have little tests because they're gonna give you some research investigation or research papers that you have to read, and then you're gonna discuss, because we do a lot of research in the program, and they wanna know if you have the knowledge how to address or how to judge a good research paper. And at the end of the day, at 5 p.m., you're gonna have the bench test. So the program director, like I told you, he do it this way so you can be a lot of I don't know how to say it, you have to show how you're gonna manage the stress, because as a prosthodontic we work a lot of hours and sometimes after hours too. So the bench test is going to be at the end when you are already tired, when you want to go home, but you have to start the test, and it's going to be like 2 3 hours, depends on all the preparation that they give you. Usually it's like 2 or 3 preparations, so they give you like 2.5 hours. So if from 7 a.m. in the morning to 7 p.m. in the afternoon, so it's the whole day of interview. And we have the sim lab where you're gonna do the bench test. Our program is a 3 year programs. So PG2 and PG3 right now, there are 4 residencies, 4 residents, because they used to only accept 4, but last year they opened a fifth position. So right now in PG1 we are 5. But for the next class, will be 2028, the program director say that he doesn't know if he's gonna accept 5 or 4, because he has the option to have 5 spots, but he only gonna accept, or only gonna fill up that spot if the applicants are really good to be in the program. He said that he doesn't want to just fill the spot just to have 5 students there. It's not the mentality that he has right now. So you can go to the next slide, please. Okay, so how it works in NOVA, I want to tell you a little bit, and feel free if you have any question at the end, we're gonna discuss, so don't worry about that. If I don't explain myself very well, or if my English is not the best, just ask me some questions. So I'm gonna talk to you about the student faculty radio. So in the program, like I told you, right now we are 14, yeah, 14, no, 15 students, and we have for 15 students in the clinic, we have 4 or 5 faculties at the same time. So usually one faculty is going to be able to work with 3 students at the same time. That is really good. Most of our faculty are permanent faculties. They're going to be there the whole day, the whole week. We always have faculty there. And I'm really proud of my program, and I'm really proud of my program director. His name is Josh. His last name is Yoshi. He graduated 2 times as a prosthodontist. He graduated first in India, and then he graduated from Nova. So he, as a program director, he's the best because he knows the program inside and outside. When you try to say something to him, he always gonna say, I was there, don't lie to me. I know how it works, you can do it. When we say, I don't know, doctor, I was so full, I didn't have time. No, you have time because I did it. So that is really cool because he already know how the program works. He's really passionate about the program, and he's really passionate about prosthodontics. He did a lot of research in India, and he continues doing research here. He's my tutor in the master's. So he's the best. I'm really, really proud of my program director. In the program, we have the opportunity to do a master degree at the same time. Why you can do it at the same time? I want to let you know that not all the prosto programs allow you to do at the same time. Some programs like Boston University that I was interested in at the moment on one of my options to do the master is going to be one more year. So at the end, it will be 4 years. In my program, you can do 3 years and have the specialized prosthodontic degree and the master degree at the same time. So we also do all the treatment is going to be interdisciplinary. That means that we work with other specialty. For example, we work a lot with periodontics, and we work a lot with the endodontics. And we also have the opportunity to do the implant maxi courses that I'm doing right now. Is going to be like 11 months program parallel to the residency. And we're going to be able to go one weekend of the month for 11 months to the university to study. We're going to do some implant placements in cadavers. We're going to be doing a lot of practice before start putting implants in the residency program. So that's really cool that we can be able to do it. And on the other hand, our program is really proud to, or most of our alumni are board certified right now. So the program prepares you to be board certified as a prosthodontic, and they also prepare you to be double board certified, because you can be able to apply for the board certification as a prosthodontic and the board certification of the implants. So you can be double board certification. I don't know if I explain myself really good, but you can do it if you want. It's not something that you have to do it, but always is good to have a backup if you're going to be able to put implants. So you can go to the next. Okay. So one of the things that I really like about my program, they spend a lot of money in this, or we spend because we pay the tuition, is in technology. And we have all the toys that we can afford. We are access to use it as much as we can. And we are able to use it on our patients. We can use it with other departments. Front of the of these machines, we have from this program from PROS, and we have other ones that we share with Perio, for example. So just to let you know, we have our own lab inside or in-house, how they call it here. So we can create, for example, in one day, we can do the crown, we can mill it and place it at the same day if the patient need it, and we can, we talk with the lab in advance to let them know. We have a CEREC scan and 3Shape scan. We have 2 and 2, we have 4. So for 15 people, it's a lot. So you always have a lot of time to, it's always one scan available. So don't worry about that. We have the printed machine. We have several printed machines. Right now, they buy the carbon 3D printer that is a huge, it looks like a fridge. It's huge. And you can print whatever you want there. We usually, for example, we are not using too much alginate impression right now. We everything do it digital, unless that the patient need it. For example, if it's going to be for a denture, or if the patient have a lot of missing teeth and the scan, is not scanning that well in that area. So we took analog impressions too. We have the new toy is going to be the micro mapper right now. We just yesterday we were testing, and tomorrow is going to be the first surgery in the program with the micro mapper. So everybody is excited. Everybody knows what time is going to be the surgery tomorrow. So we are excited to have that. We have the Yomi robot to place the implants too. So I haven't used it. I only have been in the clinic for 3 weeks. I already take out one tooth, and that was the only thing that I have been doing this week. And just already give a lot of treatment plan for my patient. They're gonna, I am just waiting to do the job for them. If you can go to the next slide. So on the clinical requirements of the program, if you want to know, we have a lot of requirements, but everything is like a minimum. They don't, I don't know, hold you back. If you want to do more, you can do it, because at the end, and it's something that my program director in Venezuela told me is, and my program director here told me too, is that the program is what the student do for the program. You can have all the toys, but if you don't use it, it's going to be on you. So you can graduate, just place one crown and one implant, or you can graduate place a lot of implants, a lot of crowns, because our program is really surgical guide, and we are allowed to put implants in the patients. That doesn't mean that we are not going to work with, for example, oral surgery, or we are not going to work with periodontics. If the patient is medical compromised, if the patient needs, I don't know, IV sedation, or if the patient needs bone graft or maybe sinus lift, we're going to do that surgery with other department, because we are not allowed to do that. What we are allowed is to do the extraction, put the surgical guide, and place the implant in something not that complicated. Okay. What else I can tell you about that? Okay, about the clinical requirements, sorry. So we have some implants. We have to put at least 40 implants in the 3 years program. We have to do hybrid denture prosthesis. They say at least 4 arches. A full mouth rehabilitation is going to be several arches that we have to do, fixed prosthodontics and removable prosthodontics, prosthesis, sorry. So in that way, we can do whatever we want in prosthesis, and they allow you to do veneers if you want to do veneers. If you want to do conventional dentures, you can do conventional dentures. At the end, you're going to give the patient at least 3 different treatment plans. You're always going to place the first one as the gold standard, but we all know that money is an issue for a patient and for us too. So depends on what the patient can afford. He's going to choose. Usually they try to go to fixed, but if they want a removable, we are allowed to do it. And we can do a lot of the removables in-house, so we don't have to send it to the lab in that case. Okay, this is my Pros family. This on the left, you have the picture. We went, well, we received a 3-day exocat course that it was really intense, but the professor flew from Arizona to Florida to give us the exocat training, and it was really good. And we always have a continuing education. For example, yesterday we have a webinar about a micromapper, and next week we have another one, and we always have lunch and learning with other companies that they go to the university. So we have a lot of resources to do. And on the right, that was the open barbecue from in the house of the chairman of the program. So this was really good. So be free and feel free to guess to do some questions.
Do have a couple of good questions. And before we start with those, I do want to say it was a beautiful presentation, Dr. Carmen. Amazing, well explained. And so moving forward, the first question we have here is, what are the requirements for admission into the program for a foreign prosthodontist?
It's going to be the same requirement for any program. You need to have the board. If it's recommended that you already have the pass on the board, but you can apply without the board. You're gonna ask to the pass for the board when you submit your papers, but to apply, you can apply without the board. You need the TOEFL, you need the letter of recommendation, and you need to have the application through pass.
One more we have is, can you tell us about the states that we can work if we can if you do the program?
Okay, I understand the question is not the way to write it, but for foreign program dentists, we have several options to get our license here. So you can do an advanced standing program to get a dental license as a general dentist, and you're gonna be able to work in the 50 states or US. But you can also do an AGD program or a GPR or a specialist program as a pros, for example, but that it doesn't going to allow you to work in the 50 states because not all the states allow us as a foreign dentist to get a license through a specialty program. The state that you are allowed right now, I can give you the link at the end, but most of the states, Connecticut, Illinois, Indiana, Mississippi, Louisiana, Nevada, Oregon, Texas, Virginia, and Washington. But I suggest to you, if you have a question in one state in particular, to send an email to the dentist board of that state. Because, for example, North Carolina is accepting right now our degree as a dental license through a residency program, but last year it wasn't available. So this can change because it's the law. It's not something that you can predict in the future, but right now it's like 10 states that allow you to practice there doing the residency program and not doing the advanced standing. I don't know if I explain myself well.
Thank you for answering that. One more question we have is, what is the TOEFL score required for the program?
Right now, last year they were asking 84. This year it was 84 too. They were talking about asking for 90, but for now it's 84.
Okay. And are they particular with any of the sections under the TOEFL, like if the reading and the listening
No,
has to be
no,
more?
no, no. They don't ask anything for that.
Okay. Um, we have another question is, how can I build my profile for increasing chances of acceptance in the program? And what things can I do to add to my profile?
Okay, well, first it depends what is your profile because I don't know. I can tell you do more, I don't know, um, hands-on courses, but if you already have a lot, it doesn't make any sense. My recommendation to you, like in general, is to know the program. You need to know the program, you need to know what they like. For example, Innova, they love technology. So if you are really into technology, you have to be able to show that you are working on that. So that will be my recommendation for you. But first, know the program and then create a plan for you and your profile.
Okay. I had one more question was you mentioned about doing Master of Science in Dental Medicine as a hand in hand with the program you are in. So are there any particular benefits with doing that degree? Like, is that required or is it a must?
No, it's in my program, it's not a requirement. But for me, for example, I took the choice to do the master because right now I'm in the university. I'm not gonna come back. I already have 5 years as a dental program, 2 years in a residency program, 2 more years, so almost 10 years studying. So I'm not gonna come back. So I prefer to do the master right now than to
Mhm.
do it after. And the second reason why I took the master is because I don't know where I'm gonna move after. My first choice it will be Texas because I can work in Texas.
Mhm.
But if I move to another state, I cannot work. I at least with the master because it's gonna be a research. I'm gonna be able to work as a faculty because I
Okay.
always like to. That's
Yeah.
one of my long-term dreams. Not right now, but
Mhm.
in the future, I would like to have the possibility to be a faculty and a master degree allow you to give more chance to be a faculty. It's not needed, but you can do it.
Okay, thank you for answering that question. We have one more is, can I apply for the exams even if haven't gotten my dental college diploma? I mean, I'm graduating in December, but I'm probably getting my diploma till January or February.
I don't know how that works. You can send an email because I don't know.
What is the best time for the applications? Like, when do the applications open for masters?
Uh,
Is there
for
anything
master or for the residency program?
for the residency program?
For the residency program is open on May.
Okay. And is there anything like, like they say, the earlier you apply, the better, and for
Usually, yeah, but they don't, they have to wait until the deadline to read all the applications. So it's not a rolling basis.
okay. One more question was you also said that the program is with match. So like there are certain universities that just go with ADA pass and some also with match. So how do we like go about it? How do we plan if somebody wants to apply for both? So what's the process? What is your advice on that?
No, because for example, my program do the match program to do the selection of the applicants. So in that way, they have to wait for the interviews. They do the interviews. The interview was 2 weeks ago on Monday. They do the interview and then they rank all the applicants. They're gonna say, I love number 1 to number 20. I don't know. And on the other side, all the applicants that went to interviews, not just for NOVA, for other interviews, they're gonna rank their university, their choices. So it's gonna be an algorithm that is gonna make the match between the programs and between the participants. So you have to have like two several logins, for example, two
Okay.
different profiles, because it's not gonna be a profile, but you're gonna link your match um,
Yeah.
profile with your past
Okay.
profile. I don't know if I explain myself.
Yeah. Thank you. Thank you so much. We have one more question is what hands-on programs can be done as a foreign trained dentist or a prosthodontist? Are they all expensive?
Yeah, this is a program that you this is a process that you need to invest in yourself. I know it's expensive, but if you want to have more chances, you need to choose. Oh, yeah, you need to show that you can have that hand skills. But it depends. If you already have like 20 years of experience in your country and you just moved 2 months ago, you don't need it. But if you stopped working as a dentist 10 years ago and you haven't touched high speed for the past 10 years, you need it. So it depends on the profile. Not everybody needed. I didn't, but I was coming from that residency program where I already placed implants. So it's different.
Okay. We have one more question. It's a bit long, but I'm just gonna shorten that question for you. So basically, it's asking if is it beneficial to do like get an experience from your home country in regard to prosthodontics, or does that person have to come to the US and do a preceptorship?
Okay. I'm gonna say it one more time. It depends. Sorry for that, but it depends. Why? Because my program have the preceptorship program. You can apply, and you're gonna, for example, right now we have two preceptorship. One from Brazil, and the other one is from Syria. But the thing is that you need, if you already have experience in your country working as a prosthodontist, you don't really need to do the preceptorship. But if you have been long time without working as a dentist, that's different. Because when you have a gap, it's gonna look a little bit awkward on your CV. So it depends. If your gap is just only 1 year, maybe two, it's okay. But if you have been without without working in the dentistry or as a dentist for the past 10 years, yes, it's really highly recommended to do the preceptorship.
Okay. We are running out of time, so we can have one more question. It's asking, when did you start your application? Was it in May 2023 or was it this year in May?
Well, I started studying for the board in March of 2023. I did my application in June and I didn't have the pass at that moment. I did my board on September. That will be after. So I did my application in June, July, something like that, 2023.
Okay. All right, we did cover a lot of questions today. And for those questions, if you haven't answered or you have some more questions, I think you can definitely reach out to Dr. Carmen. She's very active on Instagram and she also has an email ID. So you can follow her and reach out to her on My Dental Road, I believe.
Yeah.
Well, thank you so much, Dr. Carmen,
Thank
for
you, doctor, for the
doing this today.
opportunity. And if you have any questions, just let me know. It worth it. Try to work, believe in yourself, and do it. That's it.
Yep, and we'll take that to end this webinar today. And thank you everybody for joining us today as well.